Hi, my name's Dr Sameera Hamid and I'm a dentist working in London. So today we are going to talk about Invisalign, which is a very popular treatment that a lot of people go for. So I'm just going to go through why Invisalign. I'm going to explain how we diagnose it and also treatment, how the treatment process goes. So first of all, why Invisalign? So before, a lot of patients would have metal braces. Invisalign is a discrete process that straightens your teeth. It's an orthodontic appliance, which means that it moves your teeth into the correct position to give you that perfect smile. I wouldn't say it's just about getting that perfect smile. It's also if you have things called open bites, which is when you have gaps at the back or you have gaps at the front which don't allow you to close your teeth properly. Or if you have something called a crossbite, which is when your teeth are in the reverse position that they should be. This can be really uncomfortable when eating and even biting down at rest position. It can cause trauma later on with your teeth also, with fractures and things like that. So to get your teeth in the great alignment it should be in is a really good pro for Invisalign and straightening your teeth. So the way we see if you are eligible for Invisalign is we get you in for a full checkup. We just make sure that your teeth are all nice and healthy and they are able to be moved. Then we will take a scan of your teeth and take some x-rays as well. We can show you also a before and after, quick before and after simulation of what it could look like when your teeth are straightened, which I feel a lot of patients really like to see because then you can see exactly what you're getting yourself in for and how your teeth will look once your teeth are really lovely and straight. You will then be given some clear aligners that you will basically wear for majority of the day, and that's really important for your teeth to move. You will have small tooth-coloured attachments that go onto your teeth that stay on there for the entire process of the Invisalign treatment, however long your process is. And that's what allows the movement of the teeth. And then you're going to wear the aligners on top of that. So that's how it works. So usually for Invisalign, we would say it is really individual to the patient, but it's usually around 12 to 18 months for most cases, just because we want you to get the perfect bite. And aligners that you're going to get, we give you sort of the first, let's say, 4 aligners, and then you will change the aligners every 2 weeks. We will see you roughly every 8 weeks or so, and that can be a Zoom call, or you can come into practice and I can really have a look at how your teeth are doing, and then we can have a discussion and compare it to the original treatment plan that we get from Invisalign that shows you week by week or liner by liner how your teeth should look at that stage, which is really interesting and cool as well. The downside, the only thing I would say is with Invisalign is if you stop wearing your retainers after the treatment is done, so you need to wear your retainers once a night for the rest of your life to make sure that your teeth don't move back into the original position. So you have to really make sure that you are compliant with that and you're happy to kind of wear retainers for life. Otherwise it's going to be quite difficult for your teeth won't stay in the same position, and we might have to kind of do more aligners and things like that and repeat the process of Invisalign all over again, which we obviously don't want to do. So the aligners that you wear, you're going to be wearing for 20 to 22 hours a day. Literally the only time you're going to remove them is just to eat or drink. So sipping water with them is absolutely fine, but we don't recommend things like tea, coffee, any kind of drinks or any food, just because it would discolor the aligners. And also if you're eating food, it may actually fracture the aligners, which is what we don't want, and that will prevent the movement. And because you're wearing one set of aligners for 2 weeks, we want to keep them as clean as possible. So cleaning is quite easy. You're just taking them out, going to give them a quick rinse with a manual toothbrush, or you can use some retainer cleaning tablets as well. You can use those every couple of days just to make sure your aligners are really nice and clean for 2 weeks.